What causes chronic kidney disease? Who's at risk of chronic kidney disease, and can chronic kidney disease be treated? Hello and welcome. I am your host, Dr. Musam Tombene, and signing with us is Tepo Maseko, and the feeder interpreter is Sarah Glass. On Vital Signs, we'll focus on chronic kidney disease. World Kidney Day is a global health awareness campaign focusing on the importance of kidneys and reducing the frequency and impact of kidney disease and its associated health problems worldwide. World Kidney Day is observed annually on the 9th of March. Coming up on the program, we'll speak to a young woman who is the first incompatible kidney transplant recipient in Africa that was performed at the Groote Hospital. We speak to a professor from the Division of Nephrology and Hypertension at the University of Cape Town about chronic kidney disease, its prevalence, the causes, symptoms, prevention, and kidney donation and the treatment. We'll speak to transplant coordinator at the George Mokari Hospital and Sefako Makgato University about success of incompatible kidney transplant, long waiting lists, and the challenges hospitals face with regards to transplants. And lastly, we'll speak to the head of the Division of Nephrology at Helen Joseph Hospital and the University of the Witwatersrand about the objectives of the National Kidney Foundation of South Africa and the challenges that patients living with kidney failure face. Remember that you can be part of the show today by asking the guests that we have on any question that you have on your mind, or simply share your view on what we're discussing. The number to call is 011-714-0677 or 011-714-0678. Also on social media, go onto Facebook, SABC Vital Signs, or Twitter at SABC Vital Signs. Going for a quick ad break. We'll see you when we come back. Welcome back to Vital Signs. Now, Groote Hospital has become the first medical facility on the continent to perform an incompatible kidney transplant. Now, the groundbreaking procedure was performed on a 35-year-old woman who was suffering from kidney failure. The kidney transplant was made possible by using the life-saving Glycosorb ABO medical filters that allow a patient to get a kidney donation without having a compatible blood type. The organ was donated by her younger brother, who is of a different blood type, and the kidney recipient, Siobhan Meyer, joins us live to share her story with us. Thank you so much for joining us. And I think we say congratulations with respect to you getting this new kidney. How are you feeling?
Thank you very much. I am feeling amazing. There's nothing more that I can say.
Lovely. It's always good to feel amazing. And I think, you know, after having received the diagnosis before you got your kidney, I'm sure you had a very long time of not necessarily feeling amazing. Briefly talk us through what condition you had before you got this new kidney.
Oh, it was terrible. I was every second day in for dialysis, feeling drained. Never having time for my kids, never having time for myself. And yeah, having this kidney has changed everything totally, 100%.
Now, you've mentioned that, you know, it was a difficult time. I think a lot of people don't necessarily understand the problems that come with being someone that's got kidney failure. The fact that you have to go get dialysis, if you even qualify for dialysis, and you continually have to sit there for hours at a time and get this treatment only to feel better for just a couple of days, and then you're back at the hospital again to be seen. In terms of how that looked, you know, that picture of you continually being in hospital, continually getting the dialysis, how did that have an effect on you and your family?
It was, for me, emotionally, I was emotionally drained also, mostly crying because why? I could never spend time with my family, be there on family outings, be with my kids at school events or church events. So, yeah, my family has supported me all the way. My friends has always been there for me. But yeah, I'm just grateful for the second chance at life.
Grateful for a second chance at life is something a lot of people would love to receive. But I'm sure, like you know, a lot of people find themselves waiting for a very long time before they can even get a kidney, if they get a kidney. So talk us through the process that you went through to get to a point where you got a kidney.
When I got sick, actually everyone tested for me, most of my family members. But you need to be at a certain level of health to donate a kidney. And most of my family members they didn't qualify. And my sister, she was still too young. My brother was still too young. My sister never had any children. They told her that she needs to have a child first before she can donate a kidney. And then my brother said he will wait till he's 21 and test for me. And he did that. When he turned 21, immediately tested for me.
Sure.
After 7 years.
Sure. So, I mean, you know, when you give us the outline and the timeline of what you've just described, a lot of people think, you know, it was you wake up one day, you don't have a kidney or you need a kidney, someone goes and does a test and there's that, you know, you walk out with a kidney. But from what you described, it's such a long process, 7 years just to wait for someone just in your family to be able to donate to you. So how has that impacted your life? So here you are, you know, you've waited such a long time. Your brother finally hits 21 and he gladly says that he'll donate a kidney to you, and you finally receive this kidney. Before you tell us how that went, explain to me what they explained the process to be, because I'm sure you know that, you know, your brother's blood type wasn't like yours. So how did that come about? What did they say to you?
At first, I was very nervous when they told me my brother's blood type is not matching mine. And then a while after, they came to me and they said, okay, they found this new filter and it will help me have another chance at life, and my body will be able to accept the kidney. And I was nervous because, why, you know, it's 50-50. You don't know what's going to happen. And yet today I'm still overwhelmed. I don't know how to feel yet.
It is an overwhelming experience, and I think being one or the first person to receive an incompatible kidney is something that's quite amazing. You know, you speak a lot of medical first, and here you are at this point in time, alive and chatting to us today. In terms of how life is post you getting that kidney transplant, how have you been feeling?
I have so much more energy. I just want to go out there and work. But unfortunately, people don't. When they hear you were sick, they don't easily give you the benefit of doubt. So I'm still trying to get me a job. I'm working every day, trying to keep fit. And I'm trying to be more there for my kids. I'm just grateful for every opportunity I have that's coming my way now.
In terms of the things that you need to change in terms of your lifestyle, or things that you just couldn't do before because of the kidney failure, what has then changed?
Okay, so firstly, I couldn't fetch my child at school and take my child to school at the same time because I either had to be at the hospital on Monday, Wednesday, and Friday. I couldn't. So now I'm there 100% now. I couldn't go on family vacations. Now I can do that. And work. I can go work now.
It's always good to feel like you can be normal again. Well, thank you so much for joining us to speak about this really, really amazing journey that you've been on and being the first person to receive an incompatible kidney transplant in Africa. Good luck for the future, and I hope you have great and good health as you continue. After the break, we'll speak to a professor from the Division of Nephrology and Hypertension at the University of Cape Town about chronic kidney disease, the prevalence, the causes, symptoms, prevention, and of course, kidney donation and treatment. Stay with us. Welcome welcome back to Vital Signs. Now, World Kidney Day was recently commemorated in countries around the globe as they intensify their efforts to raise awareness of kidney health and the factors that contribute to this disease. Kidney disease is projected to be the 5th most common cause of premature death by 2040. Diabetes and high blood pressure are the main reasons people develop kidney disease and are responsible for up to 2/3 of all cases. To help us understand all of this and, of course, the disease in the country, the cause of the disease, the symptoms of the disease, and of course prevention methods, we're joined by Professor Nicola Wern from the Division of Nephrology and Hypertension at the University of Cape Town. Thank you so much for joining us, Prof.
Thank you very much for allowing me to be here. I'm very excited to share our interest in creating awareness and education about chronic kidney disease.
So let's get into the basics of things. Someone says chronic kidney disease. I'm sure someone knows someone in the community that, has a complaint about their kidneys. But what does it encompass? What's chronic kidney disease?
So chronic kidney disease, let's start with what you need your kidneys for. So
Okay.
You need your kidneys to eliminate toxins from your body, to remove excess fluid, and also the kidney plays a very vital role in producing hormones, particularly erythropoietin, which is what helps us produce hemoglobin to carry oxygen around the body, as well as vitamin D, which is very important for bone health. So when our kidneys start to fail, we start to accumulate our toxins and wastes, and we actually are unable to eliminate our fluids, so they accumulate in the body. Unfortunately, when it comes to chronic kidney disease, we're not aware of how far down the line we are, usually until quite a significant portion of our kidney function is lost. And it can be up to 75% before we're actually aware of our symptoms. And by that stage, it's very difficult to, once your kidney is impaired or loses its function, it is very difficult to repair that. So we actually call it the silent killer because we are often unaware that we have chronic kidney disease. So, which is why it's such an important thing to create awareness and educate people about our kidneys.
Now, you mentioned some very important things in that a lot of the time you don't necessarily see that you've got a kidney issue until it's very late. So are there different types of kidney disease that one would need to look out for?
So you rightly said that 2/3 of kidney failure in South Africa is due to hypertension or high blood pressure and diabetes. But there are other forms of kidney disease. There's inflammation in the kidney, which we call glomerulonephritis. There are hereditary causes of kidney diseases, so we need to understand who in the family has kidney diseases. And there are a whole other causes like kidney stones. So, but to keep in mind that the 2/3 of renal disease is caused by diabetes and hypertension. And I think that's where we need to focus a lot of our screening at that level to determine if we have hypertension, if we have diabetes, and if we do so, to make sure that it's actually managed well and that we take our medications well.
Now, the idea that symptoms are these things that, if you have flu, you know that you're coughing and then you'll go see a doctor, versus when you've got kidney disease, whether it's early, whether it's late, would be more problematic to find. So what are some of the things that we need to look out for, apart from, of course, screening, that would help us potentially see that we've got a kidney problem?
So I'm just going to emphasize that it's really important, the screening. It's all about, I'm going to say prevention. So number one is to actually know what your blood pressure is, know that you don't have diabetes, ensure that you're getting those things checked, and also dipsticking your urine to make sure there's no protein there, there's no hematuria there, or no blood in the urine. Other than that, you can present in certain ways, and one of the ways that patients do present is with body swelling, because you're not getting rid of the fluid, but also lethargy and tiredness. And one of the main causes of that is we drop our hemoglobin when we get chronic kidney disease, because as I mentioned before, the hormone erythropoietin actually is made by the kidneys. So we actually see a lot of anemia in chronic kidney disease. So tiredness, lethargy.
Now, you've spoken to the idea that prevention is very important and that screening plays a very big role in that. But is kidney disease preventable as such?
to be aware of your blood pressure, your sugars. We can prevent kidney disease if we control those things well. So it's really, really important that these are screened for, and we can prevent disease altogether, and we can prevent progression if those hypertension, diabetes, and the other causes of kidney diseases are managed well. So it's important that patients with chronic kidney disease have regular follow-up so that doctors can ensure that their kidney disease is kept optimally maintained.
Now, one big thing that comes up when you talk about, hypertension, diabetes, and then I guess kidney disease, this idea of genetics, that a family member could potentially have something. Will I then have something? Is this something we need to be aware of?
Yeah, I mean, it's not as I said, the most common causes, but there are genetic causes. One of them that is not too uncommon is that there are a group of disorders called where patients get cysts in their kidneys. So they tend to run in families, and what needs to occur if a patient does have these cystic diseases, or the most common one is autosomal dominant polycystic kidney disease, is that the family members get also screened for this condition. But there's quite an array of genetic causes. And when they run in families, those family members actually need to ensure that they are looking after their health at a young age and ensuring that they don't develop complications of chronic kidney disease. Interestingly, one of it's like a chicken or an egg. High blood pressure can cause chronic kidney disease, but also once you get chronic kidney disease, you can get high blood pressure. So blood pressure is a very good, it's a good way of checking. You need to check if you have high blood pressure to prevent, but also you need to control blood pressure to prevent progression.
Now, we'll have to, at some point, discuss the issue of treatments, and that, there's a vast array of treatments. So take us through how you would manage, for instance, a patient that's got high blood pressure or diabetes and you feel is at risk of having a renal or kidney problem at some point in time. What are the management steps that one would follow as the patient gets worse?
So I just started when we define chronic kidney disease, we actually stage it into different stages. So it's from stage 1 to stage 5, and just as it suggests, stage 1 is the best, and stage 5 is when you may need dialysis. And all the way through the different stages, we have to worry about interventions. So, when we get to about stage 3, we start to lose, for example, the capacity to make hemoglobin. So we start doing interventions, which actually we start giving drugs to actually improve the hemoglobin that for patients. So we can either give iron, because iron actually is involved in hemoglobin production, or we can give erythropoietin itself. And there are also some new drugs around that actually help a genetically activated hemoglobin to produce hemoglobin that stabilizes that. So, there's a lot of drugs to treat hemoglobin on the market at the moment. Then we need to control the blood pressure, and there's a whole gamut of antihypertensives that can be used for patients. But the important thing is that we treat to a particular target. So if our blood pressure isn't well controlled, we need to add on additional medications to ensure that the blood pressure targets are achieved. And then our sugars, very, very importantly, if we have diabetes, we need to ensure we have good sugar control. So once again, we need to work with our diabetologists and with our general practitioners to ensure that the sugars are very well maintained. We know that high blood pressure and diabetes really causes a chronic kidney disease progression. So we really must aim at ensuring that those things are well managed. If we get further down the line, we need to think about dialysis or transplantation. So there are different types of dialysis. We can offer peritoneal dialysis, where we actually do put in fluid into somebody's abdomen, so they dialyze through exchanging fluids through their abdomen 4 times a day normally. Or we put them onto the machine, is what most people are familiar with. So they, as Siobhan mentioned earlier, she was on a machine 3 times a week. And then if we are fortunate enough, we can actually move on to transplantation. And you can see how that really tremendously improves the quality of life of patients.
You've mentioned dialysis and how scarce getting dialysis is potentially could be because of just the resource. What do you think is contributing to all these patients that are chronically ill, that have chronic kidney disease, but just can't get to dialysis because of a number of factors? And what do you think should be done to increase the capacity in terms of those that we can dialyze?
Well, a minefield of a question, but I'm going to start at the beginning by saying that we need to be better at preventing the disease in the first place. Okay. So, unfortunately, a lot of people are ending up on our doorstep who already have very advanced chronic kidney disease. And we should be doing better at improving awareness, education, and preventing disease in the first place. When we're moving on to dialysis itself, we have limited resources in South Africa, but we need to be trying to improve access for our patients. And unfortunately, in the state sector, we only have a certain number of patients that we're allowed to, that we are able to dialyze, not allowed to, we are able to physically dialyze. So we have to decide who takes those spaces, which obviously is not a very nice decision to make. So what we need to be advocating for is more dialysis slots and more nephrologists and nursing care and technologists to actually improve our dialysis, improve the number that we can offer to allow us to dialyze patients.
An important thing that a lot of people sort of gasp and awe at is this idea of a transplant, you know? When hearing Siobhan's story, where you hear that the brother donated a kidney, the natural next question for many people is, but what does he then use? So take us through what transplantation actually means for the recipient, but also the donor.
Okay, so I'll talk about the donor. So most of the time, the donor, like Siobhan's brother, you know, really want to donate their kidneys. So it's a very fulfilling opportunity if you have, you know, for many people. You can live very normal lives with one kidney. So Siobhan's brother will have to take care of himself and have regular follow-ups himself, but he should live a completely normal life. So that is the one aspect of donation. The other aspect of donation is if there is a deceased donation. So if there is an accident and we're able to use the kidneys of that donor for our recipients. So they're the two mechanisms by which we can get a kidney. Now, donation, we know that transplantation, as you've heard from Siobhan, actually really improves the lives of our patients, and actually they do better off than on dialysis and all the complications of dialysis. So having an active transplant program actually helps us move patients off dialysis to allow new patients to come on dialysis. So having all this armamentarium, like our new filter that allows us to do the blood group mismatches, actually is beneficial in so many ways, because it actually moves a new space, creates a new space for a patient, so we can actually use their space as well. I think I got distracted on that question. Sorry.
No worries, no worries. I think it's quite informative, and it's important to actually have this conversation around transplant, because we live in this country where a lot of people just don't, and a lot of people end up sitting waiting for kidneys all their lives, or until unfortunately demise. Well, thank you so much, Prof, for joining us today and really getting into the nitty-gritty of what chronic kidney disease is. Of course, that was Professor Nicola Wern from the University of Cape Town. After the break, we'll continue our discussion around transplant and the importance of why we need to have such discussions around chronic kidney disease. Welcome back to Vital Signs. Now, access to dialysis and transplantation in the developing world remains limited. Groote Hospital has become the first medical facility on the continent to perform an incompatible kidney transplant. Here to discuss with us the successes of transplant, the long waiting lists, and of course the challenges hospitals face with regards to transplants, we're joined by Sister Matinya Tlhapane, a transplant coordinator at the Dr. George Mokari Academic Hospital, Zafako Mahato University 2. Thank you so much for joining us.
Thank you, Dr. Mtombeni. Thank you for having me.
So we've just had this big success of this first incompatible transplant, but news that come like this, where you know that you can now mismatch patients but still have positive results, must be quite exciting in the transplant space.
Yes, it is. It's yet another marvel in the organ donation and transplant. We are very excited about the innovation, and this means more lives will be saved, and it also means the quality of lives will also be improved. And this will also open a chance for patients who are on the waiting list for dialysis to get the chance if more patients are transplanted.
So let's talk about what waiting lists actually mean. Let's talk about what, this long lists that we've always heard about. I think Prof was on earlier on and she discussed that, in South Africa, sadly, you find yourself having to make a decision about who gets dialysis, who doesn't get dialysis, only because there just aren't enough kidneys available for people to get transplant. So let's talk about the transplant waiting list. What does that look like?
Okay. Currently, nationally, we have plus minus 5,000 patients who are waiting, but this includes all organs.
Okay.
Yes. So when I talk about the kidneys, which is the most common one, we've got plus minus 1,000 patients who are waiting to be transplanted. Yes.
I mean, that's a big number to have, that there are 1,000 potential lives that could be saved if either donors that want to go donate their kidneys can, or unfortunately someone has demise and we can take those donor kidneys from there and give it to the patients. But what challenges have you come about with respect to donation, organ donation in South Africa? Okay,
we're experiencing shortages of organ donation, and we have also identified that lack of information and awareness around organ donation plays a major part. And the other thing, according to the research and what we are currently facing, is that religious beliefs and cultural beliefs also play a part, where people are always saying that ancestors will not welcome them or after death because their bodies won't be whole or won't be intact. So those are the challenges. And we also notice during the transplant journey, when patients come for workup, that they have no clue of what is organ donation, what is transplantation. And also when we host our workshops and awarenesses, the patients or people are bombarding us with so many questions, so that we can see from that there's more that needs to be done, and we need to have more discussions around this topic of organ donation and transplantation.
Now, you've mentioned something very important, this idea that, education, awareness and discussions within society will allow potentially for more people to donate, because you've highlighted that religious as well as, traditional values or ideas from people prevent them from wanting to donate. What are you doing with respect to educating people about the potential good effects of donating organs?
Okay. So we are going out to the public. We are working with the National Department of Health. Last year we had massive campaigns, and we must say our donor pool really improved. And we are going to our churches, our schools, and around the hospital as well. We are educating and training staff, and we are going to the different outpatient departments and in a way trying to reach people to spread the word about organ donation and the wonders of the gift of life. We also have our recipients who we always go out with, who also spread the word and also discuss the issues of gift of life, because they've been saved and they've been given a second chance, like the lady earlier said. Yes.
It's quite interesting. All right, we've got Joanna from the Western Cape on the line. Thank you so much for your call. Good morning.
Good morning, doctor. I'm so glad I can talk to you. I was 2021. I was pick up that disease, the kidney disease. I went to a private doctor, and he said because of the metformin and diabetes, I'm now 23 years old, a diabetes patient. And at that time I was 17 years on metformin. And they took it away. On this moment, I'm not using like insulin and metformin anymore. I'm just on my sugar tablets, my high blood, and my cholesterol.
Now,
My concern is now, can I go back to just to go check up about my kidney, or I just go on with the tablet that I'm still using now?
Okay.
Because I'm losing weight now, and I'm worried.
okay, no problem. I've got your question, and it's an important one to have. So here's the answer, right? So what you've described to me is that you've been someone that's been on chronic medication for a very long time. And it sounds like you've been controlled because some medication has changed and you're finding yourself on one type of medication now. But like what the prof was saying a little bit earlier on, it's very important, especially for patients that have high blood pressure, for patients that have sugar or diabetes. What they need to do is, because of the effect that the high blood pressure and the diabetes has on the kidneys, you can't just go get seen once or whenever you feel like it. You need more rigorous assessments of your kidneys to make sure that you're not developing any early failure that could lead to long-standing chronic failure at some point in time in the future, which will then require you potentially to be on dialysis or then need a transplant. So as just a message to everyone that's either got high blood pressure or has diabetes, it's very important for you specifically with that diagnosis to get checked as often as you possibly can to make sure that those kidneys are still playing all right and there aren't any issues. Importantly though, what the prof has also said is that don't just look after yourself, but get everyone else within your family. So your children, your family members, to go out and get screened for high blood pressure as well as diabetes, because the quicker they can find these diagnoses or these problems, the more the patients will know, and they can also then find the problems that they may have with their kidneys much earlier on. So it's very important that you continue to get seen, not only by just the GP, but also by the specialist, just to make sure that your kidneys are functioning well and making sure that you are taking the step yourself to prevent any big problems or complications in the future. And I hope that really answers you, Joanna, as we look to continue our discussion here with the sister. So sister, here you are. You are someone, for instance, who has got this chronic kidney disease. You've been on a waiting list for a very long time and now are going around your community trying to find someone that could potentially donate to you. Is this something that people can do? Can they bring their own donor and say, this is the person that I spoke to, they say they want to donate, please test them and check them? How does that process go about?
Okay, thank you, Dr. Mtombeni. Yes, we encourage family members to donate to their loved ones who are having kidney problems and who are on the waiting list. So in such case, they will bring their family members and then they will be screened. And if there's a match, that's where the process of a transplant workup begins. So they've been checked, both the donor and the recipient, and then they're being counseled as well. And when everything goes well, that's when they go for operation, for surgery. Yes.
Is there someone that can't donate? So we've got instances, and I'm sure people know about certain things, but instances where if I'm 16 and, you know, my older brother or sister or mother needs a kidney, can I say, Mama, I've got you, here's a kidney? Or who and why can someone donate?
Okay. With living donation, anybody from the age of 18 years can donate.
Okay.
And somebody younger than that can't. And with disease donation, cadaveric donation, there's actually no age restriction.
Okay.
Anybody from 2 weeks, the baby should have been taken to full term. And they can donate because we also have kids who are on the waiting list from as young as 3 months.
Sure.
So this is in the case of a diseased organ donation. So from 2 years, anybody can donate. And in the case of a living donation, 18 years and above. Yes.
Now, you are a transplant coordinator, so it's not just kidneys that you deal with. You've mentioned that there are over 5,000 people that are awaiting some sort of organ. So what can be donated? So if you are at home and you aren't registered to be an organ donor, should you demise, whatever it might be, what organs can be donated?
Okay, currently in South Africa, we can donate the heart, we can donate the lungs, the liver, the kidneys, and the pancreas.
Okay.
Yes.
So
That
those are the main ones that can be transplanted from one person to the other and
yes,
be donated.
And donated. So when a person is alive, they can still donate kidneys and the liver. Yes.
Okay. And naturally, I mean, with the kidneys, there are two of them. So one would then be donated, and with the liver, it's quite big. So a small piece of it can be donated to someone else.
Yes.
Very interesting. And to wrap up our discussion, I think, what awareness do you want to raise with respect to getting people to register to be organ donors? I think, you know, as South Africans, as Africans, of people of color, there is a big shortage when it comes to donation in that sort of realm. So what message is there that exists for you to tell the people about donation?
Okay, we encourage our people to register as organ donors. And the most important thing is to discuss their wishes with their family members. Because when a person is deceased, the family members are the one to decide whether they donate or not. So in a case where there are 5 family members and they're approached by a transplant coordinator and one of them says no, it's a total no. So we encourage our people to register as organ donors at this website, www.odf.org.za. And like I've already said, to discuss their wishes while they're still alive with their family members. Yes.
Very important. Well, thank you so much, sister, for joining us and really highlighting the importance of donation, that there are so many people that are on waiting lists, and if we could potentially just register, at least it will assist someone at some point in time. That was Sister Matinya Tlhapane, a transplant coordinator at the Dr. George Mokare Academic Hospital and Sefako Makgatho University. After the break, we'll speak to Dr. Malcolm Davies, the head of the Division of Nephrology at the Helen Joseph Hospital and the University of the Witwatersrand, about the objectives of the National Kidney Foundation of South Africa and the challenges that patients living with kidney failure face. Stay with us. Welcome back to Vital Signs. Now, knowing your risk factors and reducing them can significantly reduce your chance of developing kidney disease and stop kidney damage from worsening. Now, if you're living with kidney disease, support groups can guide you to accept the new normal and better cope with the challenges of chronic kidney disease. Support comes from friends and family, even peer groups, and the National Kidney Foundation of South Africa was established to give support and information as well as educate patients about prevention, early diagnosis, appropriate management of chronic kidney disease, and of course, get that on a national basis. Joining us is Dr. Malcolm Davies, the head of the Division of Nephrology at the Helen Joseph Hospital and the University of the Witwatersrand, to speak about the objectives of the National Kidney Foundation of South Africa and the challenges that patients living with kidney failure face. Thank you so much for joining us today.
Thank you for having us.
Good. So tell us a little bit about the National Kidney Foundation. What do you guys do? What is the aim of the organization?
Well, the National Kidney Foundation is a non-for-profit organization that basically seeks to support patients and relatives living with kidney disease, as well as to advocate for kidney health. And we do that through advocating against all sorts of areas that kidney disease requires intervention in. So in terms of prevention, early diagnosis, and then, as I said, providing support to patients and family members living with kidney disease.
Now, advocacy plays such a big role with respect to people that have chronic kidney disease because of the shortage of basically resources along the line. So dialysis and transplants and things such as that. Why do you think awareness of being aware of just the early problems that you could have with chronic kidney disease or kidney disease in general could have on amplifying the effects of the organization?
So I think, as the Prof previously alluded to, really with kidney disease, early intervention makes a big difference in terms of ameliorating or slowing down progression of chronic kidney disease over time towards kidney failure. And so advocating for patients to know their status, as the Prof was also mentioning, allows us to kind of like make really important interventions to prevent and to control kidney disease in our population.
What makes kidney disease, for you, such a problem in society? I mean, I don't necessarily work with patients on a day-to-day like you would, especially kidney patients, but I know for a fact that in any corridor, in any hospital, there's a patient that's definitely there for some sort of kidney issue. What makes it such a big problem?
It is, as Prof said, a silent killer. So the problem is that most patients arrive at specialist level care far too late for us to be able to slow down the progression of the disease. And that's why, again, early intervention, early screening, early on referral to specialist services is really key for us to help these patients. Particularly, as you say, and as the Prof said, in our resource-limited setting, there's often a lack of dialysis or transplantation available to patients once they develop kidney failure.
We've got a caller on the line, Lillian from Soweto. Good day, Lillian.
Hi, how are you?
Good, how are you, ma?
I'm fine, thank you.
Good. What is your question or comment today, ma?
Okay, my question or comment is that I just had my kidney removed, I think last year. Last year. Yeah, because I had a tumor on my right kidney, so they had to remove the whole kidney. So my question is, I'm going for renal. I think they're referring me to renal clinics, that I have to go for renal clinics after my blood results. So I just wanted to know, what is the renal treatment? Is it dialysis or what's going to happen to me? Because I don't want my other kidney to fail.
Okay, lovely. So I think that's such an important question, because the fear that comes with having received some sort of diagnosis then drives this fear that you'd have. So she describes what she's described. What are the next steps for Lillian specifically? And I think we can then speak to the broader category of diseases that aren't related to hypertension or diabetes.
Okay, so for Lillian, the most important bit of information I can give you is that it is perfectly possible to live a completely normal life with one kidney. That's the basis of transplantation, as we were discussing earlier. But it is important that Lillian follows up with kidney specialists and has her blood pressure monitored over time, because as the Prof said, obviously blood pressure is a major contributor to chronic kidney disease, and control of blood pressure helps us prevent Lillian's kidney from developing failure in the future. Then obviously we would also check Lillian for diabetes, etc. going forward. It's really important that Lillian also avoids any potential drugs that have what we call a nephrotoxic effect, so drugs that can damage the kidney. And a common problem in this regard, things that we buy all the time over the counter, are anti-inflammatory pain tablets. So for Lillian, the take-home message is, first of all, your prognosis is really, really good. You don't need to be so worried about developing kidney failure, but it's important that you continue to look after yourself, and part of looking after yourself means that you attend the kidney clinic, that you have your blood pressure checked, your blood's monitored, and then really importantly that you do things like avoid anti-inflammatory tablets that can damage the kidney over time.
So by anti-inflammatory tablets, what do you generally mean? So what situation would Lillian find herself in where she would potentially need to use whatever these medications
are? So these are pain tablets.
Okay.
And they belong to a specific class called anti-inflammatory tablets, and they affect blood flow through the kidney, and they can therefore cause kidney disease over time. And commonly prescribed things are things like Brufen or Voltaren, and those kinds of drugs you want to be very careful about if you're living with one kidney.
Let's take a step back at diseases that live outside the realm of hypertension and diabetes. She's mentioned that they found a tumor in her kidney and she had to have the kidney removed. And there are many other conditions that exist. For those patients specifically, does their treatment plan look different to those that are potentially looking for transplant from high blood pressure and diabetes?
Yes, so the sort of steps we need to take to protect the kidney, there are general steps, which would be control of blood pressure, as we've said, monitor regularly, control sugar, but and avoid anti-inflammatory pain tablets. But for example, if you are living with glomerulonephritis, where your body attacks your kidney and causes inflammation in the kidney, then your treatment will be slightly different. We will need to, for example, control your immune system using immunosuppressants. I think one big category of disease that we haven't touched on yet this morning is, of course, people living with HIV. Because people living with HIV are at higher risk of chronic kidney disease. And it's really important, therefore, that people living with HIV also have their kidney function tested. And if we take a step back from that, also to follow on from what the professor was saying about screening for underlying risk factors for chronic kidney disease like high blood pressure and diabetes, it's also important that we are tested regularly for HIV, because as you know, we live in a country with one of the highest rates of HIV infection in the world. So it's important to know whether or not you're at risk for chronic kidney disease on the basis of whether or not you're living with HIV.
The search for a kidney is one that a lot of patients find themselves on whilst they're still ongoing in terms of being managed for their chronic kidney disease, whilst they're on dialysis. What makes it such a tricky thing to find a kidney?
It's two things. The first thing is the match, as we've discussed extensively already this morning. But the other thing is that in our population, we have very high rates of chronic kidney disease, which is largely undiagnosed. So we know, for example, that in patients who bring relatives as possible donors for a kidney transplant, up to 3 out of every 4 of those relatives they bring will also be living with chronic kidney disease. And that's a reflection of the sort of genetic risk for kidney disease in our population, as well as the effect of socioeconomic circumstances in our population. So to answer your question, the real problem we have is that chronic kidney disease is so prevalent And often when we go looking for a donor, what we find is other patients with chronic kidney disease who need assistance.
So with families, for instance, then that have someone that has chronic kidney disease, that then finds a family member who's younger, that might not have any of these issues currently, is it advised that we get the younger people tested and then, get the kidney removed and transplanted to the person that would be receiving it, where the potential for them to have developed something may come in the future?
We are very, very careful about who we allow to donate. And there's as Sister alluded to, there's a very intense workup process that any donor will go through. And the purpose of that workup process is basically to ensure that that donor is at lower risk as possible for chronic kidney disease and development of kidney failure and needing their own transplant in the future. So age is not necessarily a contraindication to transplantation.
Okay.
But we will not allow anyone to donate where we are concerned that they are at risk of developing chronic kidney disease in the future.
Once someone has received a diagnosis, as an organization, how do you support them?
Well, the National Kidney Foundation largely offers support to people living with kidney disease through education. We believe that education is empowerment. As I think brought out by Lillian's call, there's a lot of fear and misunderstanding and lack of knowledge about chronic kidney disease out there. And so what we do is we provide education on a number of platforms. One way, for example, is through school visits, where we go out to educate school children about chronic kidney disease. But the other thing that we do is we maintain a website, which I would urge everybody to visit, which has got detailed information about chronic kidney disease, steps to take in terms of screening, etc.
Now, lastly, as we wrap up our discussion, the big thing that you want to let people know about taking care of their kidneys so that they don't find themselves in a chronic kidney disease state, what is that?
Please go and get screened. If you are living with risk factors, please go and get screened for chronic kidney disease, and please also be screened for risk factors. Have your blood pressure checked, your sugar checked, and check your HIV status.
Well, thank you so much for joining us. I think it's been quite informative, and that is Dr. Malcolm Davies, the head of the Division of Nephrology at the Helen Joseph Hospital and the University of the Witwatersrand, speaking about the objectives, of course, of the National Kidney Foundation of South Africa, the challenges, of course, that come with that, and so many other things. And that's the end of our show. Thank you so much for joining us, and thank you for being here with us as we discuss such an important part of what everyday life is like, the silent killer, and looking out for it, making sure that you get screened so that you do not have any problems in the future. That is the end of our show. This has been Vital Signs. I'm Dr. Musam Tombeni. Chat to you soon.